So, hello, everyone. My name is Christina Romanelli, and I'm the Biodiversity, Climate, and Health Focal Point at the World Health Organization, where I work within the Department of Environment, Climate, and Health. And for those of you who know me, you probably know that I couldn't possibly be more excited than to be talking about multi-sectoral and multi-stakeholder approaches to health. One Health is actually an essential way forward to setting a new health agenda at the nexus of climate, environment, and biodiversity. And that's something that we talked a little bit about prior to PMAC in a 3.5-hour session that we had, which was specifically dedicated to the Joint Plan of Action on One Health, which was developed by the quadripartite organizations. For those of you who are unfamiliar with what the quadripartite is, the tripartite alliance is actually an alliance between WHO, the Food and Agriculture Organization, and the World Organization for Animal Health that was established in 2009. And as a very exciting development, just last year, it was expanded in March of last year to also include the United Nations Environment Program. And why is that? That's precisely because while we were working at what was meant to be the human, animal, plant, and ecosystem interface, what was really happening in the operationalization of One Health is that we were focusing very much on that human-animal interface and ecosystems and ecosystem health and the environment upon which all living beings rely was essentially being neglected. So the 3.5-hour preparatory session that we had at the time was essentially to look at, well, how can we really meaningfully change the approach we have through multi-stakeholder and multi-sectoral collaboration networks to bring in a broader constituency. Yes, I'm too short. Sorry. So you can't see me. You just think the plants are speaking to you, but they speak to me all the time. So in any case, yeah, the idea of that workshop was to really look at how we can catalyze the health, how we can catalyze our cross-sectoral collaborative work, really bring in the environment sector, really look at what tools are needed to expand that dialogue and to bring in a broader range and group of stakeholders. There are a number of stakeholders that have traditionally been marginalized in the One Health narrative. Youth has not often played a very big role in the implementation of One Health. I see some youth members already raising their eyebrows, but they're also well aware. And Indigenous peoples have not always been an integral part of the co-design of One Health approaches. However, we see that there is a shift in the way we work together. We saw that while there are many things that we have done very well in terms of cross-sectoral collaboration, there have also been a lot of gaps. But we have new tools, new ways of addressing some of those gaps. One of them was through the establishment of a One Health high-level expert panel. It was also established, I believe, in 2021 now. It's already been a couple of years. And the role of the OLEP, as it is known, is to advise, essentially, the quadripartite organizations in the operationalization and implementation of One Health. And another very exciting development, which was actually one that took place just a few months ago, was the actual launch of the very first Joint Plan of Action on One Health, which includes 6 core pillars And one of those pillars, for the very first time, is environment. So I'd just like to begin by saying, do we have a common understanding of what One Health is? I think some of you were in the other session. Is anybody in this room, were they in part one of multi-sectoral, okay, aside from our panelists, in here, in the audience, we have at least 2, 3, 4. Okay, we've got some people. We've got some people that were 6. Okay, great. So we've got some people here that were a part of those panels, and we're going to be calling on you to see if some of the challenges that had been identified in that first part of the discussion are actually being addressed in this part of the discussion, where we're talking about opportunities. So where there are great challenges, there are always great opportunities, and there are ways to harness some of those opportunities. And so could not possibly be more excited than to have with us a member of the quadripartite. Her name is Dr. Shadia Wanous. And Shadia is actually, in many ways, I always say this about you, Shadia, so she knows what's coming, and she's in so many ways the embodiment of One Health, because she's worked in so many different dimensions of multi-sectoral collaboration. She's worked in public health, she's worked in disaster risk reduction, and she is now working with the World Organization for Animal Health, and there are so many other accolades that we won't go through right now. But we're grateful that you are here with us, Shadia, and looking forward to hearing what it is that you have to share on the joint plan of action on One Health for the quadripartite. So welcome. Please. Oh, sorry, Shadia. I was told that before we're allowed to begin, so I'm already a little late, to inform the participants to share their feedback by submitting the evaluation form after the session that they're then going to collect. So please, if you see this evaluation form, please fill it out and submit it to the PMAC Secretariat, who has worked so hard to bring this PMAC to life. Thanks. Shadia, over to you.
Thank you very much, Christina. It's a pleasure to be with you here today and to present to you one of the opportunities for multi-sectoral collaboration, which is the One Health Joint Plan of Action. We launched it officially in October 2022 at the World Health Summit in Berlin. And again, we had a session in the One Health Congress in Singapore to present this plan to our One Health wider community, especially from academia, universities, private sectors, to get their buy-in and support for the plan. Next, please. So we start with the One Health definition that our high-level expert panel developed for us. And the main issue, thank you. And how this is different from the previous One Health definition that we had, that it's more broad. It encompasses not just the sectors that they have to work together under the One Health approach, which is animal health, human health, and the environment, but also it talks about the segment of the societies. We have to include all people, the whole of society approach into One Health. And we have to ensure that equity is embedded into our implementation. So vulnerable group, women and youth should be part of the equation. And importantly, also, we have this circle in the middle about the ways of collaboration. We need to coordinate our actions, which is the minimum that we can do, but we need to move to the collaboration, more integrated approach toward our interventions, We need to communicate better between the sectors and the segment of societies, and we need to build the capacity of the work health force in all of the three sectors, so we can deliver on the One Health. And we have to do all of this while keeping in mind that sustainable development is our ultimate goal. So impact assessment, which Catherine will explain later, has to be in our way of work. So why we are doing this? The member state, of course, after the COVID-19 pandemic, they more recognized that it's important to have this One Health approach, because we keep facing the crisis. We keep doing response to outbreaks and pandemics, but we don't take care of the drivers of these pandemics. And we listed here some of these drivers, including land use change, climate change, biodiversity loss. And we know that these aspects, they are beyond the health sectors, the public health sector domain or mandate. So we have to reach out to the other sectors that have these mandates and include them in our work. And importantly, we know that there is underinvestment in One Health. In all, maybe in public health is better than animal health or the environmental health, but in all, the investment in One Health and the prevention is a fraction of what we invest in response to outbreaks. So to change this, we have to work on One Health, and we developed this One Health joint plan of action. And you can see here the content, the structure of this plan. We started with the why we are doing it, explaining the linkages between these different sectors and the rationale. And then we moved to the action framework, which there we have a theory of change. We use the definition of OLEB to guide us for this theory of change. And importantly, we talked about governance. We talked about financing of this plan in the next phase. So the theory of change, I would like to draw your attention to the impact. Why we are doing this? Because we want the world to be better able to detect, to prevent first outbreaks, to detect them quickly, to respond to them effectively, and to recover also quickly. And again, to do this while thinking about sustainable development. To achieve this impact, we need to work on long-term and short-term outcomes. And this circled around the 4 C's that I presented: the communication, coordination, collaboration, and capacity building. And then we have this colorful cycle about the health action, the 6 health action. I will come to them later. One of them is about the environment. But importantly, to achieve all this, we have to go through 3 pathways of change. The first one, it's about policy, legislation, advocacy, and financing. So this is the enabling environment without which we cannot operate and implement the One Health. The second one, it's about the organizational structure. What kind of coordination mechanism we put in place in the different levels, global, regional, and national, that allow us to collaborate together. And the third, it's about the data, the evidence, the knowledge, and how to share the data among the 3 sectors and how to use them, importantly, to inform our policy and to ensure our policymakers are aware of this evidence so they can allocate funds and have the political support that we need for implementation. And these are the 6 action tracks. Many of you, they talked about the One Health focusing only on emerging infectious diseases, which is one of these health tracks. But for this, we have expanded our scope, and we will work on first the overarching action track 1. It's about building the work health capacities. The second about reducing zoonotic diseases, emerging, re-emerging. But the third one, it's about neglected tropical diseases, vector-borne diseases that are so important for many parts of the world in terms of burden and impact. And then we have also the action tracks on the food system and the food safety issues. And we have the one on AMR, which is very important issue under the One Health approach. And finally, we have integrated the environment into the One Health. And how we are going to do this? For each of these action tracks, we have an objective, and then we have important 4 or 3 action or activities that we have to focus on. So for the environment, what we want to achieve is to restore, to protect the ecosystem integrity. And why we are doing this? Because at the end, our health and the health of the animals and the health of the planets depends on the health of the ecosystem. And the actions that we will do, we will start with this understanding of the importance of the environment into One Health. And then how to mainstream it into the One Health approach in all of our sectors. And the third one, it's about education. So we have to start early. We have to educate our next generation of doctors, vet services, and ecologists about the One Health approach. So they go out to the service ready to implement it. And then we have in-service training, and we have higher education. We have master's, PhD, and so on in One Health. And finally, we talked about the data. So without the data, we don't have the evidence to implement this approach. And one of the important examples is to get the climate data, the weather data, and understand how they impact on the other action tracks. And I give you example of Rift Valley fever, which is important health issue and economic health issue because of trade impact. And to understand how the weather, the drought, the extreme event, they impact on the virus, its distribution and its virulence, and why we are seeing so much outbreaks throughout certain regions in the world. So if we get this data from the environment sector and do like layers of the health sectors, and then we can show the policymakers that when we have drought, when we have extreme event, this will what will happen. And so we have the early warning system of what to comes, and we can prevent and protect our animal health and population health. So after we develop this One Health Joint Plan of Action, we have to move to implementation. And now we are in the phase where we are developing the implementation guide among the 4 organizations that constitute the quadripartite. But also we will reach out to our member countries and to partners and stakeholders to have their feedback and inputs into the guide. And we will link this work to the Sustainable Development Goals. And we have also developed in parallel a guide for the UN Resident Coordinator and the UN country teams. So when they develop the development cooperation plans with the countries, they embed One Health into this strategic frameworks. And we talked about budget. Without budget, we will not be able to achieve or implement the One Health as we should. But we need to do, and we did actually a costing of the Joint Plan of Action, how much each action track will cost us to do. But we need to prioritize because we cannot do everything and in all countries. So we have to prioritize where the hotspots of emerging risk, pandemic threats, environmental or biodiversity loss, and we need to prioritize the activities under the action tracks. And then we have to reach out to resource mobilization and see where we can get the fund from. And importantly, we need to ensure this link with the climate financing mechanism, like Green Climate Fund, the Climate Investment Fund, and others. and the environmental facilities. This is untapped resources for us, and just last year, the One Health was included in the Green Climate Fund. So we have this opportunity to bridge between the different pools of funds. Now, when we move to the implementation, I talked about it, it's about prioritization, but it's also about engagement with the stakeholders. So we have wide range of stakeholders that we should include, but importantly, we should include the communities and indigenous group into our implementation. And also, we need to think that we are not building or starting something from zero. We build on existing frameworks. We have so many countries around the world. They started the One Health journey at least since 2000, including in Southeast Asia with the SARS, with the H5N1 pandemic, and others. So we need to build on their lessons learned, on their best practices, and try to share it with other countries. Now, how to link this to the different themes of biodiversity and climate change. And we are thankful we have our focal point, Christina, that can make this link with the COP27, for example, that we had in Egypt in November, where we presented the One Health Joint Plan of Action, and we also talked about the integrating the environment into this work. And we also had the same session in the COP15 about biodiversity. And we have the One Health embedded into the global biodiversity framework. So this kind of cross-sectoral involvement, engagement, and collaboration is very important for us to achieve the outcomes. We know that there are differences, there are different mandate, different financing mechanism, different procedures in all of these three sectors, but we have synergies and we have entry points that we can use and leverage to ensure that we work together more in the future and more systematically and more effectively. And we have opportunity coming up to join effort. And around the political issue and the advocacy for policymakers, we are engaged with the G7 platform, for example, with the G20. In the first session, somebody was talking about the finance and how the linkage between the finance minister and the health minister. So we are part of this joint finance and health task force of the G20. And they just released their first work plan. And if you read the work plan, it's about readiness to respond. So we need One Health there. And we keep advocating that we should not just focus on the response. We need to work on prevention. And we are missing, I think, the point here that we relax our attention to prevention and to One Health once we feel that we are safe again. But actually now we feel that COVID-19 is not an issue. But if you read the situation reports, we know that there is upsurge, we know there is variant and subvariants, and what does it mean? We know that certain viruses, they circulate among mammals, and how this have significant impact on human. And we know that we have 40,000 deaths per week still. But we don't feel it because we relaxed the measure and we are now back to our normal life. So this reflected in the political declarations or the political statements and documents, and we missed the One Health and the prevention there. So please join effort with us and continue the fight to ensure that One Health is there. This is our tentative timetable to finish the implementation guide and start the rollout in the countries. And finally, I leave you with the commitment from the quadripartite to advocate and to support the implementation of One Health, especially at country level and at the community level where it matters. Thank you so much.
Thank you so much for that terrific overview, Shadia. That was absolutely wonderful because you had to cover quite a lot of ground in very little time. So thank you for doing that so beautifully. You were talking a little bit about some of the outcomes of COP27 and some of the outcomes of COP15, and really it is very exciting to see that at COP27 there was a high-level presidency event that was linked to One Health. And at COP15, we actually saw that this was finally also embedded into a 10-year framework. The post-2020 Global Biodiversity Framework, for those who are unfamiliar, is actually a 10-year strategic framework to conserve biodiversity, but it's also very cross-sectoral by nature. So while we don't have a One Health target per se, what we do have in the first section is a commitment by countries that have said that the whole of the post-2020 and its 22 targets should be implemented in line with the One Health approach and other integrated approaches to health. And, you know, I think it's really important actually that we just take a step back just for a moment and talk about what One Health really is. So what is One Health? Because One Health has had many definitions over time, and none of them, and each of them were more geared toward the aims and objectives of individual institutions that were driving them. But what we've got now with the advent of the OLEP is a new expanded definition of One Health, which is very exciting. I think that while the development of the Joint Plan of Action over the past 2 years has been very exciting endeavor, this definition for me is probably the most exciting component of it because it shows the potential of where One Health can go. And I will read it to you. And then Catherine, we do have a member of the OLEP, so she contributed to the development of this definition. And I may come back to you with that in a moment. But just so we're all on the same page, it's an integrated unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystems. It recognizes that the health of humans, domestic and wild animals, plants, and the wider environment, including ecosystems, are closely linked and interdependent. The approach aims to mobilize multiple sectors, disciplines, and communities at varying levels of society to work together to foster well-being and tackle the threats to health and ecosystems while addressing the collective need for clean water, energy, and air, safe and nutritious food, taking action on climate change, and contributing to sustainable development. And you look at that and you say, wow, this is exactly what we need to actually be able to implement the Sustainable Development Goals. We need that kind of cross-sectoriality. We need to look beyond just infectious diseases. In fact, when we were at the 3.5-hour workshop, one of the questions that came up over and over again is, do we have a common definition of One Health? And what does One Health mean? And we have a very important starting point with the Joint Plan of Action. It is not an end point. This definition is perhaps an eventual end point, but we do have to prioritize, as Shadia was saying, as we move forward. So now we've got this definition, which is actually embedded in decision-making from the 15th Conference of the Parties. It was readily acknowledged within the decision unanimously by all countries. We have an acknowledgement that a One Health approach is needed to tackle the shared crises that we face. But these commitments really mean absolutely nothing. They're just words on paper unless we can actually operationalize them on the ground. And I think that some of the examples that we're going to see here are about that operationalization. It is sometimes imperfect, but we've come a long way. But along with that operationalization comes the very important need to strengthen education. And you had been talking about education. You were talking about the need for data, Shadia. You were talking about how that is fundamental to help develop early warning systems. And you were talking about the need for engagement with Indigenous communities, which leads us to think, well, so one thing is to say we need education. Another thing is to say we need data. And we obviously need to make evidence-based decision-making. But then what knowledge goes into that? And that is a vitally important question to ask. What forms of knowledge and systems of knowledge? And I know that we've got with us, actually, that might be a perfect segue into the next two speakers, one of whom is Sean Hillier, and the other who is Professor Huang Lei, who is the Dean of Institute of Preventive Medicine and Public Health and an executive board member of the Southeast Asia One Health University Network. So Seo Hun. So we've just been talking about the importance of education. Professor Huang, are you here with us?
Good morning, good afternoon.
Wonderful. It's wonderful to have you here with us. Good afternoon. We hear you very well, and we welcome you to this PMAC. And please do share with us the important work that Seo Hun is doing.
Thank you very much. And my talk will share with you about the One Health workforce. And there's a close relationship between veterinary specialists and human health specialists help us to limit the disproportionate effect of pandemic. So One Health is not a new concept. However, this field has been gaining more and more recognition in recent years. One Health acknowledges the close interconnection between human health, animal health, and our shared environment. Because more than 75% of all the infections seen in the human come from animal. There is a great and widespread interest in the effect collaboration between human and veterinary healthcare professionals as a means to prevent outbreak of infection at early stage. So, as we know that the German physician and pathologist Rudolf Virchow, who invented the term zoonotic, stated that between animal and human medicine, there are no dividing lines, nor should they be. Given the rising importance of the One Health approach in public health as well as global health, the relationship between veterinary specialists and human health specialists is getting close and close. Efforts at local, regional, and national and global level have been made to strengthen this relationship. For example, in Southeast Asia, we are glad to have a Southeast Asia One Health University Network, or in short, is a SIHUN. SIHUN is a consortium of universities that are collaborating to build One Health capacity and academic partnership in the government, national and regional stakeholders in Southeast Asia region. Primary educator, future health professionals play a key role in developing and the multi-sectoral capacity in workforce through creation of pipeline of current and future professional trained in One Health approach. So Sihun create 14 technical and core competency modules that university could adapt and incorporate them into One Health training to address infectious disease. So our educational program promote and facilitate collaborative activity and project among countries. Our key target audience are national trainer, faculty member, in-service and pre-service health professional. Example of our educational initiative include developing and strengthening curriculum, introducing innovative teaching methodology, building research capacity, One Health Student Club, and scholarship and fellowship program to support long-term capacity development. So Sihun approach to transform students from passive to active learner, applying learner-centered activities, and having multidisciplinary student learning together. We has attracted more than 90 universities to join our network, and Sihun expanded its country network or One Health University network to 8 countries from 4 founding countries in Southeast Asia. And our university members come from multidiscipline connected to the health of human, animal, and the environment, collaborating to improve multi-sectoral One Health workforce. And additionally, Sihun promote the role of the university, and beside that, Sihun represent interested of our university at the global and regional, such as a Global Health Security Agenda Ministering Meeting, Association of Southeast Asia Nation, and Health Cluster 2 meeting, etc. So the successful and the feasibility of One Health are decided by many factors, of which we also focus on gender play an important role. The idea that gender needs to be integrated into management of infectious disease has long been recognized, and in 2011, WHO developed a gender framework for emerging infectious disease. The gender pathway of some infectious disease, such as Ebola, have also been well established. However, there is still a lack of gender responsive analysis, surveillance, prevention, and control plan for many infectious diseases. This gap has also been reflected during the COVID-19 pandemic. So the COVID-19 pandemic has deepened gender inequity by impacting women disproportionately. During the pandemic, women have been disproportionately affected by mental load, workplace disruption, and impact on daily life, especially women with the children. Women have been facing an increased burden of unpaid care work, reduced access to the sexual and reproductive health care service, an increase in gender-based violence, and increased risk of child marriage. They have been unfairly affected by job loss, especially women of color and ethnic minority. So worldwide, women lost more than 64 million jobs in 2020, and resulting in an estimate 800 billion US dollar loss in income. So that also the one that Sihun also thinking about it. And One Health with gender sensitive approach can somewhat reduce the disproportionate effect pandemic have on the woman. Take the water, sanitation, and hygiene WASH program as an example. So the WASH program aims to reduce the impact of diarrhea, disease, and improve the nutritional status, health, well-being in many resources poor setting. Women and girls are usually responsible for water collection, cooking, cleaning, and childcare. Such integrated programs as WASH help empowerment women and provide opportunity to bridge the gap between practical gender needs. Example, access to the water with the gender interests. Example, change in power and role of the woman, and thus achieve a transformation in gender equity. So the effect caused by the COVID-19 pandemic also disproportionately different between urban and rural area. So at the beginning, we know that the COVID-19 pandemic case and death was mainly in large urban center. However, as pandemic developed, rural community began to bear a higher burden of the virus. This situation reflects the fact that most rural areas have a poorer practice and conditioner of disease prevention, lower access to the healthcare services, and lack other necessary measures to have a good health compared to the city. Given the agriculture, the nature, and strong bond with animal of rural residents, exposed to zoonotic disease is unavoidable. Therefore, awareness and education for the rural worker, both veterinary specialists and human health specialists, are very much needed. By strengthening the relationship between veterinary specialists and human health specialists, both of them are empowered and able to prevent as well as deal with outbreak of infectious disease. The collaboration between animal and human health party can improve the rural health and thus limit the disproportionate effect on urban and rural community when pandemic happen. So according to the World Health Organization, health is a fundamental human right and health equity is achieved when everyone can attain their full potential for health and well-being, regardless of their social, ethnic, economic, or demographic differences. So gender-related inequity in health can be related to biological or social factors. Women, especially pregnant women, are more biological vulnerable to infectious and infectious disease. Also, in many parts of the world, women still need permission from their partner to access to the health services. Health inequity is also attributable to many differences and exists between poorer rural and the richer urban area, which I have mentioned before. Therefore, to aim for the health equity is actually to remove the barrier that prevent people from having the best possible health condition, including gender and living area. So that is my last message want to send to all of you. So thank you very much for your attention.
Thank you very much, Professor Huang, and thank you very much for bringing that often under explored and neglected dimension of gender, and noting how important it is to embed it in One Health, and just the notion of inequities more broadly and the marginalized segments of society, which makes it a really nice segue into our next speaker, who's going to be talking about vulnerable groups as well. So couldn't we are very, very excited to have with us Sean Hillier, who is the Associate Professor and New York Research Chair in Indigenous Health Policy and One Health at York University in Ontario, Canada. Thank you for being with us, Sean, and maybe building a little bit on that, on those dimensions of inequity.
So, good evening. So, Kwe, Ani, Tenzi. My name is Sean Hillier. I'm a Mi'kmaq scholar. I am a registered member of the Halapu First Nation here in Turtle Island, what is now known as Canada. Grew up on the southwest coast of Newfoundland and have been in Toronto for the past decade. I'll be talking to you this afternoon, but very much 3 a.m. here in Toronto about One Health in relation with Indigenous peoples and communities. So I'd like to start with a land acknowledgement. I've lit a smudge here, some of our traditional medicines, some white sage, some ceremonial tobacco, as I think about the land that I'm currently on, and that I acknowledge my presence on the traditional territory of many Indigenous nations, that the location I'm currently in, Toronto, is traditionally known as Tekaronto and has been caretaken by the Anishinaabe Nation, the Haudenosaunee Confederacy, and the Huron-Wendat. It's now home to many First Nation, Inuit, and Métis communities. I acknowledge the current treaty holders, the Mississaugas of the Credit First Nation, and note that this entire area is subject to the Dish with One Spoon Wampum Belt Covenant, which is an agreement to peacefully share and care for the Great Lakes region. Also note 3 a.m. here, and that we had a beautiful moon. I was outside looking at it earlier. And this represents our grandmother. And so in our traditional teachings, the grandmother moon. And I think it's really important to highlight that as I begin my presentation today, because grandmother moon also for the Mi'kmaq people and many Indigenous peoples across Turtle Island represents water and the life cycle that comes about, and that without the power of grandmother moon, that our water systems wouldn't flow, and the need for our women specifically to take up their roles as water protectors for our people. So I'm going to start by prefacing my opportunities with some of the challenges. And some of the challenges I've heard from Indigenous peoples across North America, but also from colleagues around the world, around the challenge of what does One Health mean to Indigenous peoples? And I think we start with this idea of defining One Health. And I think we've just heard a new iteration of how we're trying to unsilo One Health and broaden its scope. And so I'll begin with some of the traditional definitions that we've seen out from the CDC, from One Health, from the Public Health Agency of Canada, World Health Organization. And what I really want to focus on here are some of the positioning of these words, because it'll get into some of the pieces that I'll talk about a little later in my discussion around how Indigenous voices and perspectives can be absent from these definitions. And so these are some of the current definitions that we see out there. And what I really want to highlight is the positionality of some of these words and the intention behind these words. And that when we talk about One Health as a concept, that we place that interconnectedness where we place a supremacy on people and humans before our animal, plant, and environmental relations. So the title of this is One Health in relation to Indigenous peoples and our communities. And I think that when we think about relationality, that we really want to think about how we place supremacy on humans as the main aspect of what One Health seeks to accomplish. And so how is One Health being taken up? Very broadly, I want to talk about some systemic reviews that we've done in some of the literature very broadly across the world. And what we see is that One Health literature focuses primarily around climate change, zoonosis, and social relationships between humans and animals. And that climate change disproportionately is impacting Indigenous peoples, and that these impacts are making Indigenous peoples more vulnerable to negative health outcomes. But really, there's been no significant establishment and connection between One Health and Indigenous knowledges. And I think this is really important because we've seen a significant number of studies being conducted using a One Health approach or framework alongside or with Indigenous peoples. However, many of those studies don't truly integrate and take up Indigenous knowledges within the One Health approach. And so this question of what's happening, that we're seeing the implications of utilizing One Health towards Indigenous peoples and cultures not being specifically or explicitly addressed in most research. And so we see the idea of people saying they're taking a One Health approach and that they're truly engaging Indigenous peoples. But when One Health doesn't reflect Indigenous knowledges and knowledge systems, how can you truly be taking this up in an indigenized way? So how are Indigenous knowledges then being included and considered within the current body of literature is extremely limited. And so there's a need for studies of high strength with rigorous methods, with local leadership and active involvement of Indigenous viewpoints. What we know is that an Indigenous-led approach using local knowledges is currently needed, very specifically here in Canada, across the North, to address some of the issues that we're facing. That in order to truly consider Indigenous viewpoints in research, we also have to fundamentally address and reduce the limitations and increase effectiveness of our findings, that we have to really consider the appropriateness of recommendations that we're putting forward and what benefits there are to communities in meaningful ways. A project that I'm working on with a number of colleagues in Nunavik. So this is the entire northern part of Quebec, province in Canada. So within this area, we're now the community came forward with significant concerns around zoonosis and wanting to surveil various zoonotic diseases. And as we started taking an approach that integrated Inuit knowledge within the surveillance system, what we found is that, so these are hunters. So this bottom picture that you see here is our research team and some of the hunters and trappers that were lending their knowledge to us and their deep knowledge of the environments that they hunt in, the waterways, the changing environments, the changing patterns and migrations of animals. And they were saying, we've known these animals have been becoming sick for a long time. I can point out, from a kilometer away, sick animals. And I can do that because I'm so in touch with Mother Earth, with the environments that I'm in. And that we know that these sick animals are making our people sick. And so these are important pieces that we're now seeking to integrate into a true, in my opinion, One Health surveillance system that takes into account the environment, the medicines on the ground, so our plants, the ecosystems, the animals, the changing water environments that could all lead to human impacts. And so what does this all mean? So we clearly see that there are barriers within the One Health approach to meaningful integration of Indigenous knowledges. And we continue to redefine or refine One Health still with the absence of Indigenous knowledges. We have clear issues of knowledge translation. When I speak with Indigenous peoples across the world and we talk about One Health, there is a clear disconnect between what One Health seeks to do or seeks to convey and how people perceive it. And that this creates a clash with current community understandings. That Indigenous resilience is clearly there to environmental change. We see Indigenous peoples across Turtle Island and around the world being resilient to environmental changes and being at the forefront of leading the environmental response to climate disasters that are taking place. But we also see the weaponizing of Indigenous knowledge and the weaponizing of climate change against Indigenous peoples that we see through the European Union's ban around sealing has had absolutely devastating impacts on Inuit people, their traditional diets, their hunting methods, and their food security. And that Indigenous peoples are quite literally starving in the north And around the world, we see this repeated when Western communities come in and say, we know best, and that our knowledge is superior to yours, and therefore we're going to impose this. And so we see a true need for community-based participatory research. So where are some of these opportunities? Where do we go? I'm going to draw us back to this initial example of One Health, where we place the idea of humans at the forefront, whether purposeful or not. I think in many ways, the intention is always good. That certainly funding comes when we talk about the impact that has on people, that first and foremost, we think about people when we think about health. And I really want us to perhaps flip that on its head. How can we think about One Health differently? Right now, we think about human health having supremacy over animal health, which has supremacy over our environmental or eco health. And so I would challenge us to rethink this, and that when we place from our perspective and our traditional stories, environmental and planetary and water health as the most important task to tackle, that then we start to seep down into being able to tackle local eco health that will impact and steward our animal health, that will impact, make human health holistic again and in tune, and that we have radically changed this positioning. Indigenous peoples saw their responsibility as to be stewards of the land, of the water, and the animals, and that was our role and responsibility given to us by the Creator when we were placed here, and that perhaps we need to be rethinking how we prioritize and talk about One Health. From the World Wildlife, they say that although they comprise less than 5% of the world's population, they being Indigenous peoples, that Indigenous peoples protect 80% of the Earth's biodiversity in our forests, our deserts, our greenlands, and marine environments in which they lived for centuries. And so, what is an indigenized understanding that predates One Health? Indigenous worldviews and our knowledges about holistic health and well-being certainly precede, since time immemorial, the evolving concept of One Health in both veterinary and human medicine. When I go out and I talk with elders about One Health, we use quite literally this painting. So this is a painting done by Métis artist Christy Belcourt. And so this is using a traditional technique. And so it's titled, "Man Forgets to Follow the Path of the Animals, and They Begin to Fall from Earth." And it's the idea that when we as humans forget to follow the path of the animals, of protecting and stewarding our lands and our animals, that eventually we will no longer have an earth to live on, and that we will all kind of be out in this space with no place to live. And so Western conceptualizations primarily define physical health through a deficit-based approach as the absence of illness and disease. And so Indigenous worldviews drastically challenge this, whether they be Indigenous peoples in North America, in Asia, through Africa, or elsewhere in the world. We see a differing perspective in how we think about holistic health and how we think of health and its definition at its core. A common thread of Indigenous peoples and communities in Canada, but also around the world, is in this holistic approach. And for First Nations people across Turtle Island, we think of the medicine wheel, which presents health as a balance between an interconnectedness to the health of our environments, our ecosystems, and our animals. In addition to each of us having this balance between our emotional, spiritual, physical, and emotional aspects of being human beings. And so we ground ourselves with our traditional teachings, with our traditional medicines, and we now supplement those with Western understandings. But that first and foremost, as I've articulated numerous times, that we have a stewardship role of this planet, and that this is foundational to maintaining human health, as is found in our teachings of the 7 generations. And so this is the idea that the actions we take today should be with the foresight of not tomorrow or not the next election cycle, but with the foresight of our generation 7 from now. And that if we're not thinking 7 generations ahead, then we're not thinking in the right mindset. And I bring us back to our teachings, the Mi'kmaq teaching of the great law of connectedness, that we are stewards and shepherds of our lands, animals, and environments that we belong to, that all things are beings that possess a spirit, and thus they are all connected innately to one another. And I don't want us to be confused by the idea of spirit as a Christian ideal of the spirit, but that everything has an energy. It has a connection to us, that it provides something. The rocks that are there provide something. They give us balance. They help us. We move rocks around to provide roadways, to provide access, to build pathways across the water. They have so many important aspects to the environments that they make up, that they block rivers, that they do all these really important things. And that because of colonization, we moved away from being these stewards to having to become land and water defenders. And here on Turtle Island, whether it be in Canada or the United States, this ability to be stewards has been stripped from us, and that we face armed police as we defend our waterways, as we defend our lands from mining, from extraction, from damming, from all these types of absolutely horrendous things that disrupt our ecosystems, that our people are placed in jail, that our people are shot at by rubber bullets with tear gas, that our women who are at the forefront are literally being ripped apart by militarized police for taking on those roles. And that we as Indigenous peoples, whether they're here or around the world, know our place and our role within it. And so I ask the question, how do we move forward within yet another westernized framework? Should we even do so as Indigenous people? And what is the role of our youth, as this is their future? I can speak all day. Some people say I'm very youthful in my role, but truly, how are our youth being embraced in these discussions? So where do we go? Can and should we integrate Indigenous knowledges into One Health? And if we are, how do we avoid tokenism and pan-indigenizing this within Canada as well as globally? Can we look at common characteristics of Indigenous knowledges worldwide? Are there common threads that weave together these various knowledges in a meaningful approach for Indigenous peoples that we can take to a One Health approach? Do we perhaps create an addendum of sorts in how we take up One Health with Indigenous peoples that are based on local needs? And how does One Health benefit Indigenous peoples and communities? This is the question I get all the time from communities when I come in talking about One Health. They say, well, what is this benefit of using this approach for us? Aren't we already doing it? And isn't it better for us just to use our own approach? So my last slide, how do we chart a shared path forward? And I bring you these 7 pieces of food for thought. That you have to understand that we as Indigenous peoples are not merely your stakeholders, that we are partners and that we must be engaged from conceptualization through to the implementation, redesign, and reconceptualization. That far too often we are left at the side tables to only be integrated at the implementation stage. And this is where, when we get to the implementation, it doesn't work because we haven't actually been included from the outset. How do we integrate our worldviews in knowledge systems that are equal and valid? That we have science that we have used since time immemorial, that we are now being called upon by governments to take a stewardship role yet again, yet our knowledge systems are not deemed as valid or equal still. That we must re-emphasize what One Health is and to whom it applies. In engaging in open and real discussions about One Health's relationship with and to the United Nations Declaration of the Rights of Indigenous Peoples, and how is One Health, what is that relationship with national and local rights of Indigenous peoples? That we must reverse the top-down approach to creating, to the creation of One Health priorities. That far too often, I think as we continue to hear that people are, taking an approach of this is what we shall do and let's push it down. We know that this pathway doesn't work. We must rely on Indigenous peoples on the ground to be creating and co-creating these priorities and have them fed up. That we must allow for Indigenous-led science in action. And we do this through the 4 generations. That is from our earliest children through to our youth, through to our kind of adults, through to our elders, our seniors, our people with long established knowledge, that they must all be included at the table. And that we tackle these issues through our science and action, that we know our lands. And that finally, it is important that we trust in the results from this Indigenous-led process. That when you get the results, you may not like those results, but that you have to believe in that process. You can't then demand a peer review process of the Indigenous knowledge when you've come to ask for it. And so I leave you with those words of advice, and I look forward to the rest of our discussion. Miigwech. Thank you.
Thank you so much for that, Sean. Thank you for grounding us again, and for that very holistic view of health of all living beings. As you rightly note, there is no One Health without considering Indigenous communities, because they are indeed 80% of the world's biodiversity is on Indigenous lands, and it's vitally important that we engage with them. But more than just engaging, there is a need for, as you said, the community-based participatory research will be vitally important. And more important still, perhaps, is the need for co-design as equal partners. So thank you for sharing all of those thoughts with us. And actually, it brings us to our next speaker, who will be looking at some of those dimensions again, right? Who will be looking at what is happening at the local level. Sean, you spoke to us about youth, and we're going to hear a little bit more about the role of the local and the role of youth as well in this next presentation. It is my great pleasure to invite Dr. Boripat Siriarunrat, who is a researcher at the Faculty of Environment and Resource Studies at Mahidol University, and he will be sharing some wisdom on empowering local community leadership, youth, and increasing resilience to fight the triple planetary crisis. Welcome.
Thank you, Christina. Good afternoon to all. I'm trying to bring you a different kind of story because I cannot be more thrilled when I saw that PMAC 2023 is actually come up with this theme that divided into the sub-theme that is closest to my heart, and the session chair is also the perfect person to lead the issues. So usually I prepare the abstract submitting from the wildlife health perspective, but that abstract was not accepted. So I have to be true to the story that I bring, because accepted abstract is about sustainable ocean and the people and fishing and One Health. So I have to really prepare the story because I have co-authors as well. So these are some of the story I bring from the southern Thailand, the Andaman Sea, on the west coast of the southern peninsula of Thailand. I've got Dominic, who works for the Precious Plastic program in Bangkok and also the Environmental Justice Foundation based in Europe. And Pierre, who is a PhD from France, who decided to live in Krabi with his daughters and founded a small NGO called Nature Minded. And these are my co-authors, and I try to bring all the stories that we try to work with the community in Trang and Krabi. for you. So I cannot be more thrilled to hear that Professor Vijan here and Her Royal Highness Princess Mahachakri Srinthorn actually talked about One Health and triple planetary crisis. We've been trying so hard to educate people, to communicate what this means when UNEP came up with this. So in almost every talk that I try to make publicly, I try to introduce this concept because it is very easy to relate to. The climate, biodiversity loss, waste and pollution. And these are some stories that I share with all these marginalized kids up all the way to the university president and everybody, businessmen, trying to compare what impacts that wildlife does to landscapes and habitat, comparing to us. Wildlife has been in the world forever, and they never actually converted anything into something else. And utilitarian values always win over everything. And this conference, we've been listening to the financier this morning, the bankers, the economists that is sharing different kinds of views that try to come together to make this planet a better place. So with this growing world population going to be the 10 billion people with the same space, same amount of land, how we are going to survive. But we have seen the good scenario that the waste and pollution crisis and the pandemics will be on the way down, and the resiliency is on the way up. So with that said, I think we are trying to bring the think globally, act locally theme to the Thailand youth and kids by introducing what has been talked about in the global reports and what actually can we do to reforest or restore ecosystems. We talk about ocean in crisis, so we talk to people who live off the ocean, but we are from Bangkok. So what kind of story that we can bring to them and try to convince them to values their livelihoods and also empower them that they are very important people because they live close to the ocean, close to protected areas. They are the one finding fish to feed the whole country. And also be aware of the threats that will impact their careers. Starting from climate change at the global level, bushfires in Australia, floods and droughts, and also melting ice. We have been also in the One Health world, and there's so many books and reports that we try to extract and simplify all these bullet points and facts, take-home messages, make sure that layperson, youth, school kids understand what it means. What is One Health? What is global warming? What is climate change? What is mitigation, adaptation, and things of that sort? So we try to communicate with them with their dialects because Thailand is very diverse. So the kids in the Northeast speak different languages. The kids on the island in the South speaking completely different language, and they don't even understand each other. So we tell the story of the wildfires in Australia, and the flood and the sea level rise, and also the stress and mental health on the animal side. If it's not, mental health of the people. Animal, if they don't die from climate change impact, they also get stressed and become sick as well. We told a story about, over 1 billion animals and over 1.2 billion trees being burned in 2020 bushfire in Australia, which has never been seen throughout the history. So we also talk about, the risk area. People who live on the coast should be very aware of they're going to get impacts, even though they're not the one polluting or contributing to climate change. Also, with the wildlife that will be impacted by sea level rise has been discussed a long time ago. So we have also communicated with simple facts like these kind of infographics that if you are one of these 6 lucky countries, you will be, need to do something about it now. Otherwise, you will not survive. Otherwise, there'll be a big wave of migration of people as well. And this kind of imagination picture of, sea level rise that will impact the whole city, it's also a very good means of communication so they can get the idea of what's coming to them, especially those 5-star luxury pool villa resorts and hotel, and they need to be shaking right now. We also extracted some reports. For example, the joint IPCC IP-based report. I, as a president of a small NGO in Bangkok, we actually contracted a young school student to simplify, translate them into Thai, draw them into cartoons and publish them and put them online. So everyone is accessible. So they actually understand the essence of these IP-based IPCC reports. We're trying every way we can to simplify these facts for youth. And also landfills, if you haven't visited one lately, I encourage you to go again. I mean, you can actually see all kinds of crazy stuff, especially the contamination from the waste and the chemicals and the pathogens. And also you can actually see that there's a lot of wildlife, dogs, cats, rats, and cockroaches and birds and whatnot. That is actually an interface that actually very, very important and it's overlooked. There's a lot of PhD research going on right now in Thailand trying to address the interconnectedness between hosts and vectors and pathogens actually at the landfills. So, I mean, in the local actions, what can we do to save the planet? I'm taking you to from the books and the reports to southern Thailand by bringing all these fancy infographics that looks really nice to the ground. And of course, the OLED, thanks to you guys for expanding. So everything is One Health now. In the past, we were debating whether AMR was One Health or not, endocrine disruptors or not. I mean, microplastic, now everything is. So thanks to you all. Yes. All right, so let's go to southern Thailand now. So Trang and Krabi doesn't want to be like Phuket. They don't want a lot of money. They try to preserve and protect their natural resources. They want to make profit in a sustainable way. So Krabi and Trang is on the limestone karst all the way from the high mountains to the mangrove and to the lowland forests, to the swamp forests and the lush green mangroves endlessly, all the way to shore and reef and also underwater world. It's a great place for scuba diving. It's actually, there are lots of main islands off the coast that is the last habitat for the dugong population in Thailand. So we have the last 200 dugongs that only live in 2 provinces. And that is one of the reason that I picked to work with these 2 provinces. And the people, I focus on the fishing community, that they're not indigenous by law, but we've been here forever. We don't have indigenous people, but we have tribes and ethnic people. And many of these guys are Urak Lavois and Morgan and Moglen. They're very, very small community. They have their own language, their own music, and their own beliefs and religion. They of course worship the nature because they live off the ocean. They live in the mangrove, even though they made houses from mangrove trees, from the timber. They make boats out of the mangrove and they actually live off the ocean every day. So I visited them regularly and I hang out with them, trying to understand and learn from them. Of course, we are not the one from Bangkok, know it all and bring in anything to them. They're not our beneficiaries. They are not our stakeholders. We are equal. But the thing is that we listen to what they need and bring those needs to fill the gap for them. So, for example, the livelihoods, they are a fishing community. So we try to add values to all the seafood that they bring to the table every day by working with local hotels and restaurants, using, like molecular gastronomy ideas, try to add values, not only that they sell all these fish and crabs and shrimp by kilograms, but we try to make them, to give them more of the values of the fresh seafood that they bring. We also bring the professors and to listen to them on the round table meeting, informal, with all the respects. We hang out with them in the boats. We go fishing with them. We go to visit their house, asking about their health, education. And of course, when they trust us and as a friend or family, they also tell us the top priorities that they need. They need to be involved in the mangrove management. They need to find legal pathways to do so. They need help in terms of getting ocean debris, garbage in the ocean, and turn them into, for example, the petrol or gas to fuel their boat to go out fishing. So it's actually solving the 2 prongs, that getting of waste and turning them into energy, for example. They also do the the crab banks by producing the babies, raise the babies, and then restock them into the ocean. They also told us that they have been impacted by development projects. For example, deepening the river actually put tons of sand onto these seagrass beds. And the seagrass has been dead for many square miles. And these seagrasses actually are the habitat and food for the dugong. So its impact also endangered species. But nobody listened to them. So we have to bring like ministers and congressmen, make it a very, very big deal. So the Minister of Environment also fly to talk to these people. And they're very happy that at least their voices are heard. So they're not marginalized to what extent. So we also learn from them for what they have traditional knowledge on how to nursery the seagrass and how to restore the seagrass. They actually challenge a professor that has done PhD from Denmark on seagrass that their survival rate is higher than these guys. So, I mean, of course, we respect the local knowledge and we try to empower the youth by, learning from them and give them some musical instruments and listen to their music and tell them tell them that they will have more opportunity to not only performing on their island, but if they are very good, they can actually be ambassadors and musicians that be invited throughout the country. And they wanted to be an eco guide. We also fill the gap for them so they can be showing the tourists around their home, the backyard. We brought the elders who has rescued the dugong baby and keep them alive, so that elders can actually show the prize and the knowledge to the next generation. We brought the influencers from Bangkok. We bring the grants to teach them how to produce a video or to be the reporters, to be the mobile journalism, so they can be telling the story from their hometown and not having to wait for any reporters from Bangkok to cover their issues once a year and never been told again. So we try to empower them by bringing all this to the community. So mobile journalism, citizen science, so we tell them that their hometown, Trang and Kabri, is a global tourist destination. They should be proud, they should be values their habitat and their lifestyle, their wisdoms. And so it's empower them with this pride so they can be empowered to save their homeland. We also working by showing them real actions to educate and inspire change. For example, this plot is managed by my friend Pierre. It's a community garden. So it's an open space that kids from the community can come and learn. And also they can grow some vegetables and bring home and cook. We also do the ecosystem restoration, which is the UN decades, of course, but locally it looks like this, at least for southern Thailand. We collected seeds and we do the nursery for seagrass species that can be grown in captivity and then grow them back onto the real habitat, as well as corals. We work with the schools to do the seed bank and the seagrass nursery. It's actually been requested by the school teacher whom we talked to. So we only produce only $1,000 so they can actually establish this nursery at one of the schools. It's very fantastic. So it's all for the dugong, for the people, for the food. So that is my 15 minutes. Try to limit myself. And the seagrass project for the school and community, it looks like this. So actually they can produce seedlings from the seed. So we do the eco community market, we do the food waste project, try to do everything possible to be as resilient as sustainable. Precious Plastic Bangkok, we also use the cap of the drinking water, the plastic water, and turn them into something usable, whether it's a knick-knack, a souvenirs, or a potted plants to plant the plants. So these are some recycled products that came from the ocean debris and the plastic caps. And a very simple machine can be operated by local people. And these are some of the gallery of photos that kids are really enjoying turning trash into something valuable. So to come back to the big picture, the CDC transformative outcome expected from being One Health practice, Now I cannot be happier that environment, ecosystem is actually on top of everything else. So I think it's great, even though it takes so much a long time, but we are getting there. Climate adaptation strategy, plant more trees, plant more trees, plant more trees. I think that's the only way to cool it down. There's tons of recommendation from all kinds of reports, but on the ground, it was just looking like what I just showed you there. So I'm going to end with this: human wildlife ecosystem health is in everyone's hand. So habitat conservation, keep what is left and restore some of destroyed, damaged ones. Maybe that's the integration of new way of healing the planets. And we also very thrilled that after the CBD COP15, we also very quickly grow big partnership on 30 by 30 through the Thai community of NGOs and corporations. We already secured 85 logos to be working with us in the near future. So that is my story for you. Thank you very much.
Thank you so much for that, Boripat. Wow, fantastic intervention. I don't know about the rest of you, but I am extremely inspired. And this is exactly what this session is about. It's about One Health opportunities. And I think that you found so many ways in which we can all be inspired from, the local level, from the ground up, to really engage in One Health. So thank you so much for sharing that. Thank you for sharing all of the different tools also that have been developed to support the implementation of integrated approaches to health, regardless of whether we call them One Health or not. Which actually is a perfect segue into our next speaker, who is also going to be talking about the operationalization and tools that can be used to support One Health. We have with us Dr. Catherine Mashalaba, who in the One Health world really needs no introduction. She is the principal scientist at EcoHealth Alliance, but she is also a member of the One Health high-level expert panel, and she is also a member of our expert working group on biodiversity, climate, One Health, and nature-based solutions. So wearing multiple hats, it is delightful to have you here with us, Catherine. Welcome.
Thank you so much. Thank you all for being here. And really, thank you so much to our presenters. You really covered so much that I'm relieved, because now I can just sort of summarize and highlight some global tools that I hope will be useful to really implement the good practices that we've heard. So again, about opportunities, this is really nice to be able to shine a positive light on what's already happening, what needs to be upscaled. Of course, we know we have to do things very differently to achieve the outcome that we want, the impacts that we want. But I think we have seen, that the opportunities to do that. So just to highlight here again, it's an approach, not creating a new discipline when we think about One Health. And I think it really comes down to balancing trade-offs and co-benefits across stakeholders, sectors, partners, making sure we don't leave out crucial voices. And I just want to highlight here the foundational principles. I know they're very small here, but they really relate to stewardship, making sure that we're bringing in often marginalized voices, making sure that we're thinking about parity and socio-ecological equilibrium, and really, as we've heard, not just putting humans first, but also considering outcomes that are in relation to ecosystems and animals. And I really liked what our speaker said about thinking 7 generations ahead, not just 5 years out or not even 10 years out, but really thinking for the longevity of our species and planet. I want to highlight here, there was a session on nature-based solutions, but health benefiting ecosystem services, I think we all appreciate them in our day-to-day lives and in the work we do. Communities are dependent on them, they're protecting them, but often when it comes to decision-making, we sort of forget about the importance of ecosystem services. Maybe we need a different term from them when we really relate them to human health. But of course, all of the impacts that we're seeing where we're losing these ecosystem services and the economic consequences, the well-being consequences, really core to how we understand these connections, or how we need to understand these connections between humans, animals, and ecosystems. So I just want to highlight an example here that I always feel really energized by, and we have a great steward here, Dr. Carroll, who really supported and catalyzed this program. This is with the PREDICT program, but you can see here in green Liberian scientists who are leading community outreach using this tool, this Living Safely with Bats tool. And you can see there's strong interest from the community. And this is really a dialogue tool to make people aware about the connections between bats and humans, and how we depend on bats for pollination and other ecosystem services, but also how we need to really reduce, risky contact as well. And there was a lot of interest from children, from adults, and I think people really took this seriously. What I saw here is really the power of working together. So we were working with government partners, we were working with communities, and we were working with local NGOs. So these particular scientists were from the Society for the Conservation of Nature in Liberia, the oldest conservation NGO in the country. And, they can go out and have these dialogues. There are often legal implications of some of the practices, such as hunting, that people are coming into contact with bats and potentially having this risk for disease spillover. So they can have that dialogue in a way that maybe government can't always. And, people were really receptive and said, we will try to change our behavior. And also, I think, felt really empowered. This was constructive dialogue. And the more that we have of examples of this that have really worked well, I think we can see how this can change behavior and also communication in a way that is biodiversity sensitive. Then shifting a little bit to sort of the system level. So what do we need to have in place at the national level? Dr. Borbat, you mentioned wildlife health, and I think this is a big gap when we look at global systems, and we need to reduce disease risk from wildlife. We also need to reduce disease risk to wildlife, and we see this is not a one-way street when we think about who's impacted. It's not just humans, of course, but other species. We've seen that with COVID-19, but also with other pathogens. And there are some key things we can do as we're building up systems with a One Health approach, thinking about, who's at the table with national One Health platforms as they're formed. How do we really empower the environment sector to be at the table fully? Making sure that we have, for example, policies that account for disease risk when we're doing land use planning, when we're really, thinking about how do we build in risk reduction. Again, these are things that can be financed and operationalized. Improving the use of existing tools. We often think about building new tools, and we do need some new tools. For example, we need, a parallel to the joint external evaluation, which is used for human health. We have one for animal health. We don't have one for environmental health. But also, if we look at something like this climate change and health diagnostic that the World Bank developed, it's a really good tool, and you can build in a One Health approach. But this is useful information for the human health sector, but also animal health sector. And as we build up animal and veterinary health services, making sure that we're doing that in a green way. And there are important lessons to be learned from the human health sector on how to do that. And we don't want to sort of be behind the curve, in bringing up other sectors. Then, just to show here cost of inaction, we can really use cost-benefit analysis in a very practical way. It doesn't have to be complex economic models, although those, of course, have value. But just to show here, we looked at the different impacts of Rift Valley fever on many different sectors. You can sort of get a sense of the flow of impacts, but also where to potentially intervene and who can intervene. We saw the cost of it over a 15-year time period. We saw who was really impacted in terms of losses and cost. And then we looked at what was invested in prevention and what was invested in response. And of course, as expected, response was much more expensive than what was invested in prevention. I think this gives us a key message that we really need to be investing more in prevention upstream. Now, we heard a little about impact assessment. when I look at these images, we can see this is not healthy. And I think we can also say, how did this get through impact assessment? How are these situations happening where these investments are going forward and we're really seeing, the destruction of ecosystems? I think we have to shift our whole way of thinking about impact assessments. It's not sort of a milestone that you have to go through and people get annoyed, at the process and it delays progress. I think we really have to look at it differently and say, what is at stake? Should we even be pursuing these investments in this way? And that will take change, cultural change, incentive change, building in safeguards, but it really will come down to how we look at sustainable development. What I think is important about this is One Health coordination platforms are bringing together many different ministries. They can have these discussions in a much more integrated way and make the decisions about what do we want these, development investments to look like, what sectors do we want to prioritize, and how do we not end up with outcomes like this. Just want to highlight a really exciting integrated program in Liberia with great thanks to our colleagues at USAID for investing in a really new approach. So this is a protected areas project, and it's really looking at how do we increase gazetted areas and put them under improved conservation status. These are high biodiversity areas. They're really important for preserving carbon sinks. And also looking at how do we improve the management of them to really take on good practices. How do we also increase the prosperity of communities living around these areas? And how do we do this in a way that's sustainable? So we're not losing economic opportunities, but we're really building in sustainable development. And ecotourism, I think, offers that in a really important way. Climate smart agriculture offers that, but we have to build in a One Health approach to do it right. So this is really taking an overarching One Health approach. There's a establishment of One Health conservation centers, which brings in education, which brings in really localized benefits. And I think we'll learn a lot from this. We probably won't do everything perfectly from the start, and we need help from partners such as all of you here to do it in a way that is really successful. Just want to highlight in terms of global tools, we just released these guidance documents at COP15. They are for protected area managers and have really built on what has been successful so far. And we can see here the One Health principles for sustainable tourism. I really wanted to use the slides so I could show the QR code to encourage people to utilize these and add to this knowledge base. But I think this really comes down to what a lot of colleagues already mentioned in terms of the things we need to think about, the principles for sustainable tourism. And I show this because we need to take a One Health approach throughout sectors. It's not just human health, animal health, agriculture, environment. It's really tourism, it's finance, it's all of the sectors potentially can really play a role and benefit from One Health considerations. So I just want to highlight here point 5. I think they're all very important, but equitable sharing of knowledge and benefits from tourism-based research and surveillance. So if we're going to do tourism that involves ecosystems, let's use it so that local communities benefit from knowledge, knowledge exchange, training opportunities, research, doing it in a way that is really considering access and benefits, and really, doing this in a way that is shifting away from mass tourism, but to something that is sustainable and actually beneficial. Of course, One Health has to be a leading way for that. So I just want to thank you all so much for the opportunity. I also want to share, this is a beautiful site in Liberia. There are mangroves. You can see the rainbow. I see this as an opportunity and positivity of this is what we're protecting all together, working together. Thank you.
Oh my goodness, what a wonderful way to end the presentation components of this session. Thank you for that inspiration and for sharing that rainbow and for sharing all of those very, very valuable and exciting tools. I really wish we had a whole other session just for the Q&A. Unfortunately, I think we are already potentially over time, so that will not be possible. However, I'm glad that we took the time today to show you where some of those opportunities are, because we're often talking about the challenges and we spend much less time talking about where the opportunities lie, where the entry points are. But before I go, even if we're over time, there's something I absolutely want to do. I promised I was going to put somebody on the spot, and that's exactly what I'm going to do now. So I see that we have here with us several youth. And I see that we have Omnia El-Omrani here with us as well. And she was actually instrumental in disseminating the voice of youth at COP27, of course, as COP27 president, she would be, but also at the 15th Conference of the Parties, where she was instrumental in supporting the negotiations and discussions on nature-based solutions and, of course, on One Health. So, Omnia, I would like to invite you here to say some closing words. Yeah, right here. Right here.
So hi everyone. I promise I won't be long so that you can go to the coffee break. First of all, thank you so much, Christina, for having me. It has been so inspiring to see both the bridge between knowledge and implementation and action when it comes to One Health. And for us, specifically for young people, I had the opportunity in my past life when I was a student, not so long ago, working with medical students. And one thing we were really passionate around was the One Health approach. But what we do as young people, and which makes us very unique, is how we collaborate in a very natural way. So it wasn't just medical students working together. It was medical students, veterinary students, as well as pharmaceutical students coming together and realizing that we need to integrate One Health approach, not just in our education and our capacity building initiatives, but in the way that we do action. And that is why only 3 years ago, we formed the first ever student alliance that really brings in students from multiple health disciplines to work together and implement One Health actions on the ground to our local communities as well as on the global level. The World Health Student Alliance had a couple of conjoint initiatives that I want to quickly share because they're very interesting. The first one was a 1 minute One Health competition. And it was a really cool initiative because we invited students both from the health sector as well as from the environmental sector and the veterinary sector to really think about how to explain the importance of One Health in just 60 seconds. And it was interesting because we received over 100 video submissions from over 30 countries, and all of them were creatively done, but also inviting medical students in general to think about how to explain One Health and how to bring it closer to the communities and the people. The second interesting initiative we did actually with WHO, it was focusing more on antimicrobial resistance, but as an incubator, it was interesting because we invited students from different disciplines to form teams, come up with an initiative that addresses One Health or AMR, and then submit it. We received over in our first competition 63 submissions from 30 countries as well, and we chose 10 winning teams. All of them went to Geneva, the WHO HQ, to get mentorship for a week to see how they can scale up their initiative, take it back and implement it in their own countries and their own organizations. But also not just at the times of when we're able to, think together how to do action, we did it at a time of crisis. The World Health Student Alliance was fundamental during the COVID-19 pandemic because once the lockdown started, we formed together a COVID-19 student task force and we collaborated with different UN organizations in the WHO. Namely, we did an interesting initiative. It was with UNFPA. It was called Youth Against COVID. We did a series of videos so that we wanted to help young people to be the trusted messengers, the communicators when it comes to the lockdown measures, how to protect themselves, their families, and their loved ones. We did 6 videos that were translated in 20 plus languages and received over 1 million views. And they were also used by the students, and they showed us how they brought these important knowledge to their communities and people during the crisis. So these are just a few examples of what we can do together as students coming from different disciplines, as young people, whether we're from the health discipline, whether from the environmental discipline, but there's so much that we can do. My message for you are three main things when it comes to working with young people, because sometimes it feels a bit complicated. We're so many different organizations. Where do we start? But it's simple. I think you need to think about what you want to do. Do you want to work on research? Is it more a policy? Is it more local action? If it's research, that I'm really a strong advocate. And this is one thing that UNICEF actually taught me, is the importance of youth-led research, because we already work with our communities, with our demographic. So really use us, and we will also learn from you how to get the data and the information, as well as analyze it and produce policies and design interventions according to that. The second thing, when it comes to action, you want to work with the people, you want your solutions reaching more the local context and to make impact. Really work with us, because we are already there. We're multiple networks, many countries around the world, and it's also very easy, and we're very accessible and approachable to work with, but we also have the energy to keep on doing that. The final thing, when it comes to policy, when it comes to design up to legislations, we are very dedicated to do that, especially when it comes to the health of the environment, climate justice, and environmental justice, because you can see around the world right now, young people are leading lawsuits when it comes to deforestation, when it comes to the exploitation of wildlife. So it's important to also support our voices and our activism when it comes to that. And then finally, I believe that together, and only together, we can do greater things. Thank you.
No, I'm going to stay here. We're going to take a photo of everyone. What a terrific way to close this terrific session. So thank you so much. For those of us who have joined us online from Canada, Sean, you are a hero. It is, I don't even know what time it is in Canada. It's like 4:30 in the morning. I'm so sorry. But thank you. Actually, I'm not entirely sorry, because if you hadn't, then you wouldn't have been able to share the valuable experiences you had. So thank you very, very much for that. Thank you very much, Professor Huang, for being with us from, you are joining us from Vietnam. And thank you, immense thank you to every one of our panelists for being here, and to all of you. This is only the beginning of the discussion on One Health. There are many other opportunities to overcome all the challenges that we are all aware of. So thank you all for being here. Terrific session.